Hello friends, I am Dr. Jayanti Kamat, IVF consultant, obstetrician and gynecologist practicing at Srishti Fertility Care Center and Women's Clinic at Andheri, Mumbai. So today we will be talking about how to take care during early pregnancy, what to do when you miss your period and how to take care of yourself during first 3 months of pregnancy. As you know friends, pregnancy is not a disease. It is a perfectly naturally occurring event or phenomenon. Of course, some women do experience some complications which are associated with pregnancy and some discomforts which are associated with pregnancy. So today we'll be talking about when to plan for your pregnancy, what do you do when you miss your period, when to consult a gynecologist, when to do your first sonography, how to tackle the various discomforts which a woman experiences during a pregnancy, how to reduce mental stress and organize one's lifestyle during pregnancy. So first and foremost, planning. Just as we plan for our education, our career and so many events in life, pregnancy has to be planned. And when do you start planning? You have to plan 3 to 4 months before you are actually planning to conceive. There are certain do's and don'ts. First of all, you have to make your body suitable to nurture a baby. For that, you have got to be healthy yourself. So initially, if you are overweight, try to lose weight, try to take vitamin supplements, get basic blood investigations done. If you are anemic, you will have to take iron supplements and you have to get yourself screened for certain diseases so that these diseases don't flare up during pregnancy and cause problems to both the mother and the baby. This entire thing is called as preconceptional care and counseling. For this, you need to consult a gynecologist who will guide you as to what tests are required for you. There is no one size fits all, and this treatment, care and counseling is highly personalized. Well, now you have missed your period. What do you do? So first thing is, when a woman misses a period, it does not necessarily mean that she is pregnant. A woman can miss a period because of some other hormonal disorders such as thyroid, or the most common nowadays, that is polycystic ovarian disease, or it could be even because of stress. But whenever a woman misses a period, pregnancy has to be ruled out. So how do you confirm pregnancy? So the tests which are used to detect pregnancy are based on a hormone called as HCG, or human chorionic gonadotropin. This hormone is secreted by the placenta in huge quantities. So when this gets detected, we know that the woman is pregnant. So what are the different ways in which we can test this? One is the urine pregnancy test. All of you must be familiar about this. There are so many kits which are available in the market. So when do you do the urine pregnancy test? You have to wait for a week after you have missed your period, because if you do it earlier than that, it might come negative. Second is the beta HCG test. Beta HCG test is detection of this HCG hormone in the blood. Now this test is relatively sensitive and pregnancy can be detected quite early. Then there are certain doubtful conditions, like when you do your urine pregnancy test, ideally both the lines should be dark, but sometimes one line is faded. What does that mean? That means that whether the woman is pregnant or not, it is slightly doubtful. So what do you do in such a situation? You either repeat the urine pregnancy test after 1 week, or you get a beta HCG test done. What about sonography? Many people feel the sonography is a sure shot way of diagnosing a pregnancy, But believe me friends, if you do a sonography very early in your pregnancy, or maybe just after you have missed a period, we will not be able to see anything. So the first sonography is ideally done at 6 weeks of pregnancy, unless there are other symptoms for which we'll have to do it earlier. So at 6 weeks we can see the fetal heart ticking, and this is a very blissful moment both for the patient as well as the doctor. I, being an IVF consultant, I come across so many patients who are struggling to conceive since so many years. So when we see that ticking heart at 6 weeks, I don't think any joy in the world equals to that. And this is a joyful moment both for the patient as well as the doctor. So this is about the early scan. Then comes like, when should you visit a gynecologist? You should visit a gynecologist as soon as your pregnancy is confirmed, or you can get your pregnancy confirmed even at the gynecologist office. And do not delay this visit to the gynec, because many people feel that you should go to a hospital or a gynecologist only for registration for your delivery. Now this is not right. Remember, by the time you realize you're pregnant, already the fetal organs have already been formed. There's already a life which is growing inside you. And a gynecologist who's a trained professional and an expert can foresee a lot of problems, if at all, when they examine you. You may not feel any discomfort, or you may not have any problems. That doesn't mean you have to delay the visit to the clinic. So get yourself examined as early as possible. Then, what are the discomforts which a woman experiences during pregnancy? One is nausea and vomiting. This is very common. Headache, fatigue, tenderness in the breast, slight pain in the abdomen, frequency of urination. The woman feels like going to the washroom very often, and then she experiences a lot of mood swings, certain likes and dislikes, doesn't like certain smells. So all these discomforts are associated with pregnancy. Remember, a woman, it's not necessary that every woman should experience all the discomforts. Every pregnancy is different. In fact, even in the same woman, if she's been pregnant for 2 times or 3 times, each pregnancy and pregnancy symptoms and experience is going to be different. So starting from the first discomfort, that is nausea and vomiting. Why does this nausea and vomiting occur during pregnancy? As I told you, there is a hormone called as HCG, which is secreted by the placenta. So this hormone, what it does is, it goes and stimulates the vomiting center which is present in the brain. And then because of this stimulation, the woman feels nausea and sometimes she vomits. How do you combat the symptoms? First of all, your gynec will give you certain tablets to control these symptoms to a certain extent. But what can you do at home? You have to modify your lifestyle and dietary habits. You can take something dry like a biscuit or a cracker or a toast as soon as you get up, and you have to take care that you're adequately hydrated. Just because you are having nausea and vomiting, that doesn't mean that you have to starve. So you have to take plenty of water as much as possible, not as soon as you wake up, but at regular intervals. Eat something dry, try to eat citrus fruits, and as far as eating is concerned, I would prefer the whole fruit rather than the juices, because when you consume the juice, the fiber is removed from that. And again, in early pregnancy, constipation is also a problem. So if you drink only juices and where the fiber is removed, you may have constipation. Secondly, all these juices, is better you make it at home and not have those ready-made packaged juices which are available in the market, which contain a lot of preservative and a lot of extra sugar which is not really needed. Then certain women have an aversion towards certain smells and certain food stuff. You can avoid them, and so that they do not trigger your sensation of nausea, vomiting. There are certain homemade remedies like ginger or lemon juice you can try, that they are quite safe in pregnancy. Now, this vomiting and nausea, vomiting in pregnancy, sometimes in some women can be excessive. The woman just cannot eat, she keeps on vomiting, she cannot even take even water. So this is known as hyperemesis gravidarum. Now this is a very serious condition, and if there is excessive vomiting, you need to consult a gynec. Now this excessive vomiting could be because of a higher secretion of the HCG hormone. Sometimes it occurs when there is multiple pregnancy, twins or triplets. It can occur in an abnormal pregnancy, what we call as the molar pregnancy, or it can occur due to other hormonal disturbances. So this has to be taken care of. Sometimes we even admit patients and give them a lot of IV fluids and various other injectable medicines to control this vomiting. The second thing is, just because you're vomiting, you should never starve, because what happens is, once you starve, there's something called as ketone bodies are formed in the body, and this ketosis again causes vomiting, and vomiting again causes ketosis, and this becomes a very vicious cycle. Some women feel that just because they are vomiting all the time, it's better not to take any food. That is not right. Now, what are the other ways in which you can avoid this discomfort? Take meals at smaller intervals. Why do I say that? Because when in pregnancy, there is a hormone called as progesterone, and this has an effect on the stomach and intestines, and it slows down the movement of the stomach, the movement of the intestine, so the digestion becomes quite slow. So if you take a heavy meal, you may get your digestive system gets really overwhelmed with it, and then again you will start vomiting. So try to divide your meals, like take smaller meals throughout the day. Avoid eating spicy food or hot food. Avoid eating anything from outside, and please do not self-medicate. Do not take any medicines without the prescription of a doctor. Second is the tiredness and fatigue. Some women experience tiredness and fatigue. Why? Because one thing is the intake or the food intake may not be proper, and pregnancy, because of the hormonal influence, the woman feels a little more sleepy and she may feel a little more tired. So what do you do with this? You have to take rest. Try to organize your lifestyle. When I say rest, it is not just physical rest. You have to reduce your stress levels as well. So you have to organize your lifestyle and see that you get adequate rest as well. Then another symptom is heaviness or tenderness in the breast. So this also occurs because of hormones. The woman should wear a very well supporting bra, and she should take a normal diet, and this will pass away in course of time. Another thing which women ask me is, doctor, now that I'm pregnant, should I exercise? Should I go to work? So these are the common questions. I always advise patients to be active during their pregnancy unless and until there is a medical indication. A woman can do light household work. She can do a few light exercises. Walking is a very good exercise. Only thing, do not indulge in in very strenuous activities. Yoga and pranayam, they are very good during pregnancy. They not only help you to be healthy, but even your mental stress is relieved by doing these exercises. Then there are some women experience a lot of mood swings and depression during pregnancy. Now what happens is, the woman has to cope up with her career, her house, and there are so many people around you in the environment who keep giving you all sort of gyan or knowledge about what to do and what not to do. Please take all this advice with a pinch of salt. Take it positively and just think that these people are concerned about you, and so they are giving you advice. Follow your doctor's advice strictly and enjoy your pregnancy. Thank you.